program. I do believe we have the best health care system in the world. That's why the premier of one of Canadian provinces came here just last week to have his heart operated on. He said, "It's my heart. It's my life. I want to go where it's the best." And he came to the United States. It's where a member of parliament, a Canadian member of parliament with cancer, came to the United States for her care. They all have coverage there, but what they want is care. So coverage does not equal care. What we heard from Senator Conrad is also right. Half of all the money we spend in this country on health care is on just 5% of the people. Those are people, for the most part, that eat too much, exercise too little, and smoke. And as a result, we need to focus on those people. So the focus ought to be on the best possible care. People are happy with the quality of care they get and the availability, but they sure don't like the affordability because it's not affordable. And, you know, Mr. President, the first week in medical school we got our stethoscopes, and the professor of cardiology who just died this past year, he said, this is to listen. This is to listen to your patients. Listen to their heart, listen to their lungs, but it's a constant reminder to listen to them. Listen to what they are telling you. And it means to listen to the other people in the room. If you're seeing a child, listen to what the mother is saying. If you're with an elderly person, listen to what their adult child is saying. It's a constant reminder to listen. And I have great concerns that people around this table are not listening to the American people and are fearful of the consequences of this large bill, which is why only 1 in 3 people of America support what is being proposed here. And that's why so many people, Mr. President, are saying it's time to start over.
Let me just, there's one thing I've got to, there are a number of issues as usual that I've got significant difference with. I just am curious. Would you be satisfied if every member of Congress just had catastrophic care? You think we'd be better health care purchasers? I mean, you think, is that a change that we should make?
Yeah, I think actually we would. We'd really focus on it. You'd have more, as we say, skin in the game.
Because
people would, and especially if they had a savings account, account, they could put their money into that, and they'd be spending the money out of that.
Would you feel the same way if you were making $40,000, or you had that was your income? Because that's the reality for a lot of folks. I mean, it is very important for us, when you say to listen to that farmer that Tom mentioned in Iowa, to listen to the folks that we get letters from. Because the truth of the matter, John, is they're not premiers of any place. They're not sultans from wherever. They don't fly in to Mayo and suddenly, decide they're going to spend a couple $1 million on the absolute best health care. They're folks who are left out. And this notion somehow that for them the system was working, and that if they just ate a little better and were better health care consumers, they could manage, is just not the case. The vast majority of these 27 million people or 30 million people that we're talking about, they work every day. Some of them work 2 jobs. But if they're working for a small business, they can't get health care. If they are self-employed, they can't get health care. And you know what? It is a scary proposition for them. And so we can debate whether or not we can afford to help them, but we shouldn't pretend somehow that they don't need help. I get too many letters saying they need help. And so I want to go to...
Mr. President, having a high deductible plan and a health savings account is an option for members of Congress and federal employees.
That's right, because members of Congress get paid $176,000 a year.
Did take advantage of that.
Because
members of Congress that the park rangers get in Yellowstone National Park.
John, members of Congress are in the top income brackets of the country. And health savings accounts, I think, can be a useful tool, but every study has shown that the people who use them are folks who've got a lot of disposable income. And the people that we're talking about don't. So, I'm going to go to Henry. Henry Waxman.
Mr. President, I just want if some of our Republican friends would like to have seniors on Medicare have catastrophic coverage only. I'd say to the seniors in this country, and we've heard mention of them being the people who are worried about this Medicare, this health care bill, they ought to worry if we don't do something. Because not only will we hear ideas of putting them on catastrophic coverage only, because that'll save a lot of money, Paul Ryan has a proposal right now to say that Medicare recipients in the future ought to have just a little voucher, and then they can shop for their own insurance. They can be prudent shoppers. Well, yesterday I had a hearing with some people who were supposed to be prudent shoppers. There were people from California who were told by Anthem WellPoint that their insurance was going to go up 39%. And could you imagine, seniors, if you have to go shopping with your voucher and then you're told, oh, by the way, this private policy that you're going to have to buy just went up 39%? And the way to save the federal government money is to shift it on to the seniors. That's where we're going if we don't do anything. Now, what do we do that makes sense? We've got to hold down health care costs. We had some ideas that we seem to agree about to hold down health care costs. One idea I did find peculiar, and that's to have the medical malpractice issue at the federal level. And the Republican proposal is to adopt the California law. Well, the California law is in effect. It's been in effect since the 1970s. And Californians are faced with a 39% increase, so it isn't holding down their health care costs. We got to really look at holding down health care costs. That's hard to do unless we have insurance reform so we can get more people buying health care. I thought Tom Harkin just summed it up so well. All these issues go together. If you don't bring more people in to be covered, and you segment the groups that are covered in high-risk pools, they pay more money. Everybody else is going to get a break. Well, under the Republican proposal, the people who get a break for insurance are the people who are healthy. The people who have to pay more are the people who are sick. Is that what we want in this country? Now, I hear people all day say, Mr. President, the public doesn't want your plan. Well, if I heard the kind of rhetoric over and over again that I've heard from some of the Republicans, I wouldn't want your plan either. A federal takeover of health care? That's not what's being proposed. Somebody said that people ought to be able to buy a policy that suits their needs. Well, how many people are going to come forward and say, I don't want certain things covered, and then find out that they're sick and they need that coverage? We need to have a market like the federal government employees, like members of Congress. We know what we can choose. If somebody wants to choose a health savings account, that means because they want to put some of their money away because it's tax-free and it's just a really great deal if you got a lot of money. But most people want to know they're going to have necessary medical coverage for the doctors and the hospitals when they need it. And you have something that's basic to everybody. Well, they ought to have that for people who are buying private insurance as well. We had 3 witnesses yesterday. A woman told us that in her family she had a child with a hole in his heart. And that became a pre-existing condition. So she has health insurance coverage to this individual market. But she says, I barely use it because I'm afraid to use my health insurance. She's now told she's going to have this 39% increase. She said her health insurance is going to cost her about as much as her mortgage payment each month. She's afraid to drop it because she doesn't know where she could ever get health coverage again. Another woman had asthma, and that was considered a pre-existing condition. She was going to face a 39% increase as well. Now, if they were pooled with everybody else in that small business and individual market, which is what our bill does, then there are more people buying insurance and there's more leverage. It's spreading the costs, not making people have to pay more of these costs. The people who we're talking about are people in small businesses where the small business can't get insurance because Well, they got one employee with a real serious medical problem, so nobody in that group's going to get coverage. The employer can't afford it. Or women cost more for small businesses if they're in that workforce, especially if they're older.